Okay, well, I'll get started then. So I just want to thank everybody for joining us on this webinar today. We're very excited to be talking about childcare in Wisconsin and digging into this new report that we just released with the Archbridge Institute. My name is Miranda. I'm a policy associate here at Will, and I'm a co-author of of this report that we just released, Reforming Childcare in Wisconsin, Reducing Regulatory Burdens to Expand Access. I'll be guiding this discussion today with our panelists, Dr. Ed Timmons and State Representative Joy Gobin. So Dr. Ed Timmons is a senior fellow at the Archbridge Institute and the founding director of the NE Regulatory Research Center at West Virginia University. His research has been published in many scholarly journals, has been heavily cited by the popular press, the Federal Trade Commission, the Obama White House, Senate hearings, and he has authored numerous articles for media publications. He is regularly asked to provide expert testimony in state legislatures across the U.S. on occupational licensing reform and practice authority of nurse practitioners. He completed his PhD in economics at Lehigh University. Then we have Representative Gobin, who is a dedicated wife and mother of four with a lifelong passion for education and service. She has a bachelor's degree in elementary education from the University of Wisconsin-Green Bay and a master's in education from Walden University. She's a former elementary school teacher and longtime small business owner, currently operating a childcare center and remains deeply engaged in her community. Her involvement has included serving on the board of the Green Bay Area Christian Homeschoolers, participating in the Legacy Builders 4-H Club, and being an active member of Christ the Rock Church, the NRA, and both the Brown and Outagamie counties, Republican Party counties. She's previously served on the Wisconsin Speakers Task Force on Human Trafficking and has represented her district in Wisconsin State Assembly since 2022. So thank you both for joining us today, and we're very excited to have your valuable insights with us on this call. I'm just going to kick off our webinar here with a short presentation just to give us some background on the childcare issues. So I'll share my screen quickly here. Okay. So I just want to start by just addressing why childcare is an important issue that we should be addressing in Wisconsin. So to start off by saying that staying home to take care of your child or children is a luxury. It's not just the cost of childcare that is an issue for families, it's the cost of everything lately. So these are just a few examples. Nationally, the cost of childcare has increased almost 30% just in 4 years between 2020 and 2024. The annual household income needed to afford a typical home has increased by almost $40,000 just since 2020. Also, healthcare premiums have been increasing for both workers and employers. So not only is it more money for workers to pay out of pocket to pay for healthcare, but it's also employers not being able to increase wages as much. It's depressing workers' wages. And you can see on this chart here, this is the graph of the century, is what it's known as, how everything has been increasing. We have housing, food, medical expenses, college tuition, and even when you look at the more affordable lines, even things like new cars and clothing have been increasing more than they were previously just in the past few years. So it's the cost of everything, and being able to give up that income is not necessarily an easy choice for people to make. And then, of course, it's still an issue even if people were to stay home and go back after their kids go to school. Childcare is still needed before and after school because it doesn't align with working hours necessarily. It's a choice between the loss of lifetime income that people would be giving up to be able to stay home with their kids. It's money that you can't save for retirement or invest. It's giving up future promotions and wage increases. And then, of course, if you do take that time off, it's hard to get back into the workforce after being gone for however many years. So it's just painful to think about those things that you might be giving up in the future. And that might also be a consideration for not wanting to stay home. And then, of course, it's not an option if you're a single parent. I believe it's 20% of children now are living in a single parent household. So of course, if you're the only breadwinner in your home, that just is not an option for you or your family to be able to stay home. So it is important for us to be able to address this issue. For those who, of course, you want people to stay home if they want to and they feel that they're able to and they plan for that. But we don't want people to feel like they're stuck between a rock and a hard place, that they can't afford anything, but they can't stay home, take care of their kids either. And then a few other statistics just about the childcare issue in general. So in Wisconsin, the average childcare costs are now about 17% of household income compared to our surrounding Midwestern states. That's about 3 to 7% more of income compared to those. And then on the supply side, we do have a shortage. So there are only about 171,000 spots available and about almost 290,000 children who have the potential need to be in a child care center or needing child care. So we have a significant gap, which means that we have a supply shortage here. And then, of course, making that supply worse is that lead teachers, the average pay for them is only $13.55 in Wisconsin. And about half of child care providers, of lead teachers, don't receive health benefits. So they're understaffed and they have too many children they need to take care of. So they're burned out, but then they're also not making enough. So then they don't want to stay in that job as long. Lots of turnover, and that just exacerbates the issue. And then 33% of centers have closed due to staffing shortages. So just some background there on the supply issue. And then, of course, this is also a workforce issue. So the childcare industry itself is significant. It generated $6 to $8.5 billion in revenue and directly employed over 1.5 million workers. But of course, it's not just the people they're employing that makes them a helpful sector and necessary sector of our economy, but the fact that they're able to allow other people to work in their own respective sectors and be able, it's very important to make sure that people are able to go to work, and that's an important part of having childcare. So just a couple more things. We have nearly 80% of women and almost 25% of men who leave the workforce do so to provide necessary home and childcare. Again, if that's their choice and they're able to do that, that's great, but we don't want people to feel like they have to do that or that they're caught between a rock and a hard place because they have to make a huge sacrifice to give up an income that they might not feel like they need, that they're able to give up. And then Wisconsin has a more severe, according to the Department of Commerce, workforce shortage, with only 54 available workers for every 100 job openings. So obviously, if people want to work, we don't want to make it harder for them to do so. And then this is a very timely conversation here in Wisconsin. We had a Child Care Counts program that began in 2020 with federal money that was given to us during the pandemic. To date, it has sent about $850 billion, I believe, million or billion dollars to help support childcare providers. And that program is set to end at June 30th this year, so just in a couple of weeks. And there was a survey put out about a month ago now, a month and a half ago, by the Department of Children and Families and Governor Evers saying what might happen, what might be the outcome once that money officially ends. So over a third of the respondents said they were likely to reduce their available hours in childcare spots. 57% said they would expect longer wait lists, and 78% expect to raise weekly tuition for infant care, adding $1,300 to $2,600 to families' yearly costs. So we're heading for a cliff, is what it feels like. The Governor Evers did propose $480 million to continue this program in our current biennial budget proposal, and the legislature did remove that. So that kind of leaves us with this question of, what are we supposed to do now? This is obviously something that we need to address and that people want to address, but it's just without funding, it's a matter of how are we going to do that? So I'll stop sharing my screen here and we'll kick off the discussion. So with all that in mind, I'll start with you, Representative Gobin. So what is the main debate that's happening in the legislature to address this issue, and what do you think might be missing from that conversation?
There's lots of conversation, but unfortunately, there's still debate on, what is this actually an issue? Is this an issue that the state can fix? When childcare counts they were fully funding childcare count centers, we're still closing. So there's concerns there. Can we actually do anything, and how do we do that? So that's sort of the main conversations, trying to get people who don't have children to understand the importance of this for workers, for families, for providers, for everybody. It is an issue that is going to touch everybody, but some people just aren't aware how that's going to affect them. So we need to share how important it is. Right.
And then can you also speak to your experience as a childcare provider, and what I know you are talking with other childcare providers as well, kind of what things you guys are experiencing. And I know that you're trying to expand this conversation debate a little bit beyond just funding versus no funding and some of these other maybe regulatory solutions that we've discussed in this report. Just giving some of your experience on what you've heard and how you think regulatory reform would help with that.
Okay, I do have to make a correction. I am not a current provider. So I did provide for many years, but I'm not in the a legislator and a provider. But I did run a in-home childcare center. Regulations, it felt like were continually being added. An example, at one time, there was a child that was left in a car. And so then the response was right away, all providers needed to have a alarm system in their car. And then the result is, for myself and many other people I knew, well, we will no longer transport children. So when we are putting in legislation, when we are regulating, the idea is to create quality childcare. But are we doing quality childcare when we're just constantly adding regulation? I feel that regulation is a burden, and for some people, it's a burden that's great and causes them to leave the industry or to not join the industry. And I think providers are speaking out about regulation because they're leaving the industry. In-home childcare is an area that we have lost a great deal of providers. My understanding is up to 60% we have lost. They're not being replenished. And it's because when you look at the burdens of coming in and changing your home to meet the regulations and the requirements, they're great. And to many, it's not worth doing that. So I think just watching the numbers, we can see that regulation is a burden.
All right. Well, with that, I'm going to switch it over quickly to Ed. So just start digging into a little bit more about what we have in our report. So my first question for you is, what does the research that we highlight in the report say about regulatory reform helping lower childcare costs?
So we highlight two papers that were published. One paper looks at how childcare staffing regulations and also how education requirements for directors affects the cost of childcare. And what the authors find, it's a study by Gorey and Thomas that was published in Applied Economics. They find that if you increase the number of children that each staff member can watch, so increase the child to staff ratio by one child, that this reduces the cost of childcare by as much as 20%. And further, if you eliminate the requirement for teachers to have a high school degree, this also is associated with significant reductions in costs, as much as 45%. And I think consistent with Representative Boebert's experience working in the industry, there is another study that was published in the top journal in economics, the American Economic Review, that looks at how staff ratios and education requirements for directors affects the number of centers. And what the authors find, it's a study by Hodson Zhao, that if you reduce the number of infants that each staff member can watch, that this results in a 10% reduction in the number of centers. So just reducing the number of children by one reduces the number of child care facilities by 10%. And if you add 1 year of education to the director, requiring them to complete another year of education, this reduces the number of centers by 3%. So pretty good evidence that these regulations are increasing cost and also reducing choice for parents, fewer options as a result of these regulations.
So the impetus for us doing this report and looking at Wisconsin and doing this profile is that there is a regulation index that ranks all 50 states based on their regulatory burden for childcare, which Wisconsin is the 10th most burdensome state according to that index. So could you speak a little bit about that index, what goes into it, and why Wisconsin is so high on that index ranked?
Absolutely. So the index compares all 50 states, and it essentially ranks states from most burdensome regulation to most flexible. And it looks at a variety of different factors. It looks at the maximum group size. It looks at child to staff ratios, and it breaks it out for every single age group because it varies dramatically depending upon whether or not you're talking about very young children or older children. And it also looks at the training hours requirements and the education requirements for both teachers and directors. So in total, the index has 17 variables. And it essentially scores each state on a scale of 0 to 10, with a score of 10 being the most flexible and a lower score indicating a more burdensome regulatory environment. So Wisconsin did end up coming out 40th, so one of the more burdensome states nationally. And some particular aspects of regulation where Wisconsin seemed to be quite a bit more onerous than other states is specifically for younger kids, looking at the child to staff ratios. Wisconsin seemed to be more rigid with respect to the number of children that each staff member was able to oversee or to watch. And also, Wisconsin had more burdensome education requirements, both for directors and teachers, but especially for the directors. So those factors were what drove Wisconsin to get that more burdensome score nationally in the index.
So part of this profile that we did was comparing it to our Midwestern neighbors, or at least the ones that touch our borders. What insights do you have as to how we compare to our neighboring states, where we might have room for reform? And also nationally, we didn't talk about the national observations so much in our report, but I think given that you've worked close with this, I think it'd be interesting to hear what you think we could learn from other states outside of the Midwest.
Absolutely. So if we focus in and hone in on the age group of 2 to 2.5-year-olds, Wisconsin has a staff to child ratio of 6 kids for every staff member. And if we just compare that regionally, this is more rigid than both Iowa and Minnesota. Iowa and Minnesota allow 7 children for every staff member. And if we look at Illinois, Illinois allows 8 children in this age group for every staff member. And even if we look at Wisconsin, this is quite interesting. If we look at Wisconsin, as soon as you hit 2.5, you can watch 8 2.5-year-olds. But that group of 2 to 2.5, or 2 and 6 months, you can only watch 6 in this age group. So this, we think, is potentially creating some significant cost burden and also potentially restricting the number of centers. And if we open it up, if we broaden it out to look at this nationally, because the region in general does score quite poorly on the index, and we focus in on that group of 2 to 2.5-year-olds, there are 8 states that allow each staff member to watch 10 or more children. The average is 7. So nationally, Wisconsin is much more rigid with respect to the staff to child ratio for this age group. If we turn attention to the education requirements for the director, directors in Wisconsin have to complete 2.5 years of education and training. If we look at Michigan, Michigan only requires 1 year of education and training for directors. If we broaden this out nationally, there are 19 states with less burdensome director requirements than what Wisconsin has. Just to give you some sense of what some other states look like, Idaho doesn't license childcare directors, so there's no education and training requirements. Maine requires 6 hours. Connecticut requires directors to simply complete 1 course. And Kansas requires 6 months of experience, no education. So, you can throw a dart on a map of the United States, and it's very likely you're going to hit a state that has director requirements that are less cumbersome than what Wisconsin has.
I think that's very interesting, and it's nice to see that there is some room for reform. And of course, with these things that we've talked about in the report and what we've just highlighted, that it's not just these ratios or staff regulations or facility regulations that are a problem. There's a lot of different things that could be problematic, and it's good that we're at least starting a conversation about the types of things that we could change and how we could even broaden this to the types of regulations or rules or requirements we can be looking at to ease the burden off of our providers and hopefully create some sustainable solutions for the childcare industry in Wisconsin. So with that, I want to turn back to Rep. Gobin. I know you've been working very hard on a lot of different reforms that in last session and this session. So I want to open it up to you to talk about all the amazing ideas you're working on and how you think it's going to be helpful for the childcare industry in Wisconsin.
Okay. The majority of my ideas were put out last time. Some of them have been sort of tweaked and changed to find compromise across the aisle. So there are two ways in Wisconsin that we license or regulate childcare. We have home childcare and we have licensed centers. So in the sort of the home category, which again, we mentioned that we've lost so many of those, which has a big impact because in-home childcare is generally less expensive. So it's something that we want to boost. Within home childcare centers, you can be certified or you can be licensed. When you are a certified provider, their regulation is very similar. There are some differences that make it a little less burdensome, perhaps. But you can watch 6 children, but 3 of those children have to be related to you. So my bill simply says that you can watch 6 children and be certified and not have that relational component. It seems rather simple. You're already watching 6 children. Now you can watch them even if they're not related to you. Another option is the large family child care center. Currently, as an in-home child care provider, you can watch up to 8 children. It varies based on how old the children are. But we are creating the large family, so then I can have another provider come and work in my home, and we can then care for up to 12. This is really, it seems like, how is that really going to be helpful? But working in your home on your own can be really you're kind of lonely. I mean, yes, you're with children, but having another adult there that you can bounce ideas off, talk to, work with the kids, it can just help create a better environment, and we're going to provide some more slots. In the center-based areas, we have apprenticeships for childcare in our state, but those apprentices, when they work in the childcare center, do not count in the ratio numbers. So if you're a 16-year-old apprentice, you don't count in the ratio numbers. So I have a bill that says if you are 16 with supervision, you will count in the ratio numbers. So that's going to be a benefit to centers and as we get more young people into childcare. The sort of big bill that I've been working on is the 4K program. We're actually calling it the Elementary Readiness Program. And a big problem in childcare is those ratios, and 4-year-olds, you get the best sort of bang for your buck as the childcare center. But when 4K school opened, the childcare centers lost those 4-year-olds. And it was quite an economic burden upon the centers. So we are going to say that a childcare center can offer a 4K readiness program, elementary readiness program, and then they would be funded the same as the school is funded. So it really opens options for families, really helps childcare centers. I have had so many centers say, if this program happens, I can keep my center open, because the having those 4-year-olds in my center would make such a difference. Economically, it helps to pay those infant instructors even more. So that's a positive. Other things that we're working on: childcare savings accounts, ratio changes. Edward talked about ratios. Kind of working on that. I had a bill last session. you would have thought I was going to murder children. That's not the plan. We want quality childcare. We want children to be safe, but there are some areas that we can tweak a little bit to make it that it's more profitable while being safe. Keep saying that. We want safety. We want quality care. There are simple things that we're trying to work on our side. Because I also was mentioned the instructional time that's necessary. We don't want to diminish the instructional time, but that instructional time has a fee. So if we can find ways that we can fund that fee, what are those courses you need? Can we make that more accessible? Those are areas that we can work on. There are other options from other representatives. We have no interest loan programs, trying to set up your home childcare, maybe you're expanding, it's very expensive. So we're trying to offer a no interest loan program, trying to get businesses to sort of buy in on this. Businesses will benefit if they have workers, but they can't get the workers if they need childcare. So another Representative Armstrong is working on some offering tax incentives if they are buying slots. So those are some important things. Maybe not legislatively, but I think we really need to work on targeting. If we're using state funding, we really need to target it. In the state, we have what are called child care resource and referral centers. They are required by state statute. They cover the entire state, the services that they offer. They work really hard to support child care workers, to recruit new child care workers. So if we're going to put funding towards an area, that's something that I'm working on, trying to make sure that they have the funding necessary to continue the recruitment that they are already working on.
All right, well, this is going to be my last question. So if anyone has any questions they want to put in the Q&A, now is the time to do that, and I will cipher through those and ask them once we're done here. But my last question here, which is for you, Rep. Gobin, but also Ed, if you have anything you'd like to add, feel free. What is your response to those who are concerned about the quality and safety of children that you just mentioned? And are there other opposition arguments any other arguments you'd like to address?
Well, as I've said, nobody wants to have, childcare that doesn't offer good quality. As a parent, I'm going to look at where I'm bringing my children, and I want to bring them to a safe, loving person who's going to care for them. Some of these regulations, that's not what's being provided. Having a bachelor's degree in early childhood education does not mean that you're going to have, the loving grandma kind of type who wants to just care for your children. So we want to make sure that Wisconsin has quality childcare, but accessible childcare. What's happening is a lot of people are running unregulated care. So do we want that everyone is just going out to unregulated care? Because nobody knows if that has any quality.
Anything to...
Yeah, I'm sorry, I'll just say two things. In the report, we looked at both complaints and injuries for child care centers and looked at how Wisconsin stacks up to other states regionally. And for 2022, we found data on both complaints and injuries. And Wisconsin had more than 1,000 for that year. And, of course, Wisconsin comes in as 40th in terms of the burden of its regulation. Now, if we compare the injuries and complaints with Iowa, which came in as 11th nationally with respect to the burdens of its regulation, Iowa had just 200 complaints and 2 injuries. So certainly this isn't going to answer all questions, but certainly this simple comparison would suggest that Wisconsin really isn't getting better quality with the state of its current regulations as compared to Iowa. And then, I think Representative Gober makes an outstanding point. When we think about these regulations, we don't want them to be so burdensome that we're actually pushing prospective childcare providers into the gray market. We want these childcare providers to be providing services legally. And if the regulations are so stringent that they actually result in providers providing service illegally, that's exactly the opposite of what we would like to accomplish with these regulations. These regulations are not ceilings. Childcare providers would still have the option, if they so choose, of having more rigid staffing requirements or having their staff obtain more more education and training. But now there would be flexibility in the market. And I think that's ultimately what we would like to see. We would like to see parents having the option to choose the right choice for their family and for their children.
All right, well, thank you both so much for that. So I'll go to a few of the audience questions. So the first one we have here is from Scott. He says, we've been subsidizing childcare for decades, currently more than 800 million in the current budget, and they have not resulted in more slots or more affordable childcare. How can we ask taxpayers to pay more subsidies with any assurance that doing so will actually improve access or affordability?
That's a great question. A lot of the funding that you're probably looking at goes to Wisconsin Shares, and that does provide affordability for low income people who need to work, but they don't have the money to pay for the very high cost of childcare right now. We are working, like trying to find solutions that are not adding a lot, more taxpayer funding, but help to find solutions. So yeah, it's a hard thing, and you're correct.
We have two questions from Chelsea, so I'll ask one and then the other. So one says that would 4K funding include for in-home family child care centers as well? Would this also include those children with special needs that require 3K?
It would not be for 3K, but an in-home provider could participate.
And then her other question, oh, looks like it just went away, but from what I was reading, she was concerned that we don't want to decrease the level of education for childcare providers, worried that that wouldn't help at all with their burden, especially if we're adding more children or things along those lines. So what's your response to that concern about possibly lowering educational standards?
I don't know that anyone really has mentioned lowering the standards. We have the foundational courses. I talked about just trying to find access to those courses, making them more affordable.
Mm-hmm.
Yeah,
and I think
I would just say, in terms of the education requirements, you do see significant differences across states. But ultimately, I think we could hone in and focus on the staff ratios if that's something that created some concern. Certainly the staff ratios, there's a lot of room for reform in Wisconsin.
I think also that time in service should count. So if you have a lot of experience in childcare, that should count. That has value. And I think that that's often pushed aside. Just that piece of paper, that bachelor's degree, doesn't always mean you're a better provider.
All right, we have another question from Julia. She says, how would any of this help teachers make a living wage and stay in the field?
Okay, very good. So the 4K program would offer, so more money is coming into the center that allows you to raise wages or to at least keep pace with the child care accounts wages that were put in.
I mean, I'd also say if you potentially make it easier for childcare facilities to open and you have more childcare centers competing for these teachers, then we might expect that you'd see some pressure for wages to rise. if ultimately you have more centers that are looking to hire workers, and there's more opportunities and more competition for these service providers, then we might anticipate that there'd be increases in wages.
All right, there's another question about the 4K programs from Scott. He says, is there a sense of whether that public schools might oppose this idea?
Well, there's always a carrot. So right now in 4K, the spending is either a 0.5 or 0.6. So we have explored if the state can afford and trying to figure out how we can work that if we could go up to 0.7, that would offer actually more funding to the schools as well, so that they're not going to be left out. We've also talked a lot about the people are not going to leave the school 4K programs. So there's plenty of 4K kids for both, for childcare centers as well as the schools.
We have another question that just came in from Chelsea. What is the likelihood of this passing? It sounds like this would be a huge deal for her, so she's curious about that.
Yeah, yes. Contact your legislators, particularly on the Senate side. That's where we're having the most challenge. So please reach out. There are a lot of people supporting this, working to get this through. If you are part of any associations, they all need to reach out. They need to contact their legislators and explain how important this is, and that it will make and have a big impact on your center.
All right, and then we had a comment from Kimberly. She's asking about space. She says that adding ratios won't necessarily make a difference if space regulations are still in place. If your center is
It depends on the center. You're correct. And
Yeah.
even
Are there
if you change ratios, it does not require a center to change their ratios. They might be fine with the way ratios are. Maybe it involves adjusting rooms. But that's the center, and that is the center's decision to make the changes or to not make changes.
Would there be maybe tandem legislation that if the ratios were to increase, that there would be an equal conversation about expanding space, if that's something that would be interested or helpful?
I would talk to childcare centers before I would make any statement on that, because it's really the things that I am working on are childcare provider led. So I would let them discuss that with me.
Just looking through these questions here just to see. Brooke asked a question about insurance companies possibly dropping childcare centers.
We have discussed that with the insurance companies, and when the legislation changes, when the statutes change, the license or insurance companies would provide care. So that was brought up last time, and so it was a concern. So I reached out to the people who help us with insurance issues, and yeah, we discussed that. So not a problem.
And then this will be the last question. Is there a specific name of a bill or something that they should be asking to push through if they contact their legislators?
If you talk about the 4K bill, that's what I've been going around door to door discussing it with people. Reach out to my office if you have any questions. We can clue you in some more.
Excellent. Well, thank you so much, both of you, for joining us and having this discussion. This is something that we hope to be able to continue working on at Will. This is a topic that we know is very important, and we're excited to see talking more with childcare providers and their concerns, other stakeholders, learning more about this, and hopefully finding some of these other solutions. Of course, these things aren't necessarily a silver bullet. It's not going to be one bill that fixes everything, and it's going to be a lot of discussion, but we're excited to be having this discussion, hosting it, and having you guys talk about it with us, and thank all of you for joining us. So thank you guys again, and I hope you'll have a great rest of your day.
Yeah, thank you for having us.
Thank you. You too.